Hello, my name is Dr. Jason Cuellar. I'm a board-certified, fellowship-trained orthopedic spine surgeon, and I'm here today in Key West, Florida, an amazing little island outside of Miami. One of my best patients, Brandon.
Hello.
All right, well, Brandon, you had the lumbar disc replacement surgery. Tell me about that whole experience, just from the preoperative to the surgery, post-operative recovery.
It was wild. That's not a word I throw around. I've been through a lot in my life, and I've had some fantastic experiences on both the good and bad end of the spectrums. This was something that you can't really prepare yourself for mentally, but the actual procedure itself was pretty straightforward and easy. You were literally replacing 3 levels out of the 5 in my lower lumbar region, and I went under, came out, walked out of there, and went to breakfast and dinner with my wife the following evening and morning, and I haven't looked back. You're probably one of the best people in the world that does this, in my view. And I feel like once you've gotten to the point where you're decided you're gonna have this, you can't go wrong going with you and your colleagues. And I say that as somebody who has his life back. Like, I'm pain-free.
Well, I appreciate that. I'm so happy that you got an awesome result.
All of it was pretty easy. I just am the type of person that really pushes himself, and I think when you do too much too soon, it feels like you are instantly aware of that. But I never felt like I was in jeopardy of the surgery failing or anything like that. It really felt more like I just was trying to push the curve too quickly. But I want to stress that I was literally pain-free walking 2 weeks after this surgery. I mean, my personal life, picking up my kids, as you said and alluded to earlier, I'm a pretty strong guy, and I've set state records in powerlifting, and ultimately for me to think about being less than or weak was terrifying. And ironically, what's happened as a result of this surgery is I've gotten my ability to do all of the things that I love back, and I'm getting stronger every day. But yeah, it was terrifying, and it is a big procedure, and it's not a decision that I think anyone should take lightly. I can only speak for myself and the results that I've gotten, and it was well worth it for me. I feel like I can absolutely do everything I want to do. Now it's just, it's funny, I'll use the jiu-jitsu analogy. I tell my students the difference between executing a technique expertly and like a white belt is in the details. Right? It's just like anything else in life. And this is no different. I just have to listen to my body. I still feel like I'm healing, and you've told me as much, that's fine. But I do feel like there's been an incredible increase in strength and mobility. So now I'm not holding myself back from doing anything. I'm just sort of tempering it with a little bit of new respect for being able to do these things that I had previously not been able to do due to this back pain. So no, I think it's great.
Awesome. So at the end of the day, are you happy you had the disc replacement surgery? Extremely.
And I think anyone that sees this interview is going to be able to get that pretty quickly. But again, I want to stress this because it's hugely important to me and anyone else that's considering going through it, which I'm always happy to talk to anybody that has questions about this procedure. I send a couple other people your way that will probably be calling you. I really think that it's a personal decision to partake something that seems this extreme. It's a hard concept for people to wrap their heads around. But with the results that I've experienced and the way I continue to feel stronger and better every week, I really don't think in good conscience I could tell anyone that was deemed appropriate to receive the surgery not to do it, because I think that would be a real disservice. And I think if they are financially and medically able, that this is a real alternative to going through a life that is less than.
All right, well, Brandon, you've been an awesome patient to take care of, and obviously you're my patient for life now that I've done surgery on you. it's been really great to see your improvement, your fast improvement. I mean,
I feel like this went well enough that I don't really feel like this is going to be an issue for me in the long term. Maybe we'll exchange X-rays instead of Christmas cards here and there. But ultimately, I think if anyone is considering having this done, you're a great person to have do it. And my results have been so good that it's one of those things where you have a lot of trepidation at first, and this doesn't happen often in life, at least it hasn't in mine, but you have a lot of trepidation at first, then you actually go through with the event after a lot of soul searching, and one of two outcomes happens, right? Like you either are like, okay, I did it, it didn't go as expected, but I want to see what I can take from it as a learning experience, and we'll move on. Or conversely, like in this scenario, it goes exceedingly well, and you're faced with new possibilities, and things that you felt like you couldn't do for a long time are now doable again. And for that, I owe you a huge debt of gratitude.
Well, thank you. It's been such a pleasure.
You're very welcome. Thank you.